Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Christy Turner and I am the registered dietitian. My role is to help our patients understand their diet for kidney disease. In this module, I will review the importance of limiting salt for your kidney health. Limiting your salt intake is important for achieving optimal blood pressure control. Salt is sodium, so anytime you hear the term sodium, we are talking about salt. One of the kidney's important jobs is to filter sodium out of the body into the urine. Damaged kidneys cannot filter sodium as well as healthy kidneys. As a result, sodium can stay in your body and can cause blood pressure to go up and can cause swelling. Our clinic recommends aiming for less than 2,400 milligrams of sodium per day. Higher sodium foods to avoid include the salt shaker, which is the obvious one, salty snacks such as chips, nuts, pretzels, processed meat such as hot dogs, processed lunch meats, and bacon, canned items, fast food, convenience foods, and frozen dinners. Better lower sodium options include lower sodium canned items, unsalted snacks such as unsalted nuts, pretzels, tortilla chips, salt-free seasonings such as Mrs. Dash, which can be found at most grocery stores in the seasoning section. Kirkland Organic No Salt Seasoning can be found at Costco. Using fresh herbs and spices, vinegars and oils, lemons and lime juice are other ways you can add flavor to your foods without adding salt. You can check the front of the food package to quickly identify foods that may contain less sodium. For example, look for foods with claims such as salt or sodium free, which has less than 5 milligrams of sodium per serving. Very low sodium has less than 35 milligrams of sodium per serving, and low sodium has less than 140 milligrams of sodium per serving. Reduced sodium means that the product has at least 25% less sodium than in the original product. Light in sodium or lightly salted means that the product has at least 50% less sodium than the regular product. No salt added or unsalted means that no salt is added, but does not mean it is sodium-free. Check the nutrition facts label to be sure. Products that have claims indicating they are lower in sodium may still have very high amounts in them. This is why it will still be important to examine the nutrition facts label on the back of the product. For example, regular soy sauce has 920 milligrams of sodium in 1 tablespoon. The less sodium soy sauce has 575 milligrams of sodium in 1 tablespoon, so as you can see, it is still quite high in salt. The sodium content of a product is required by law to be on every nutrition facts label. When grocery shopping, read the nutrition facts label for sodium content and compare products to make lower sodium choices. The percent daily value lets you see if a food is high or low in sodium. 5% or less is considered low in sodium. 20% or more is considered high in sodium. Aim for no more than 6 to 10% of the daily value for sodium and aim for 140 milligrams or less total sodium milligrams per serving. The nutrition facts information is based on the serving size of the product. There may be more than 1 serving in the package, so be sure to check the serving size on the label. Let's review what you have learned by answering some questions. Why is sodium restriction important for patients with kidney disease? To help with blood pressure control. What is the best way to compare products for sodium content? By reading the nutrition facts label on the package. Congratulations, you have completed the module on sodium intake and chronic kidney disease. Please check our website for additional educational modules on kidney health.